Audra in a second, but she's going to set up some stuff. But remember the very first time I came in, do you guys remember the very first seminar we did, what it was on?
Yeah, vitamin D.
No.
Vitamin
Hot stuff.
K.
It was basically on statins and cholesterol. Remember that? Everybody was freaked out about that.
Oh, yeah.
And what's that? Okay, well anyway, the number one thing I get as a health coach is people want to know about statins and cholesterol. That's one of the things. And so many people, I have so many clients, I was able to either get them off of statins or have them not take statins at all. Okay? Because one of the things with statins, one of the problems with statins is it causes a lot of muscle aches and muscle pains. And a lot of times people don't even need a statin. So unfortunately, doctors a lot of times what they'll do is they'll treat numbers. So you guys heard of LDL, right? The bad cholesterol? Okay. Well, actually, it's been a lot of studies. Just came out with this study, and this guy, he's called a lipidologist, which means he studies cholesterol. This is what he does. And he's LDL. First of all, LDL is not bad. Okay, there's different types of LDL. I won't get into that. But what he did was he went ahead of time. He says, I'm going to do an experiment, and he says his LDL was way up here. Okay, normally they put him on a statin right away because he's going to have a heart attack. So he turned around. He said, I'm going to eat 10 Oreo cookies a day. 10 Oreo cookies a day, and my LDL is going to go down. He predicted this ahead of time. And that's what he did. He ate 10 Oreo cookies a day, and his LDL was cut in half. Okay, there's a study, I can send you the study on this. And everybody's freaking out. Everybody knows Oreos is not good for you, right? Anybody here think that you should be eating Oreos to get your LDL down? So it was it. And then he did what they call a washout period. And the next one, he did nothing. And he went back to his normal diet. And his LDL went back up again. And then he took a statin, Crestor. And that dropped it too, but it dropped it not as much as the Oreo cookies. So you think about it, say, I'm going to eat Oreo cookies to lower my LDL. So this guy was really, really healthy, but what they found is just because the LDL goes down, up, doesn't mean necessarily you've got problems. There's more than just numbers. So again, I have different numbers. So if they're telling you want to take a statin, contact me because I can run some numbers for you and show you you probably don't need a statin. You're late.
I know.
What kind of bugs have on you? Okay, so let me introduce Audra here. So, and I didn't know beforehand. You guys heard of Kegel exercises?
Yeah.
Okay. Okay. What do Kegel exercises do?
To strengthen your muscles, so you have to feel it, so you don't have a lot of.
Right. Let Audra get into this, but basically we all have what's called sphincters. We have sphincters in our stomach. We have sphincters down there. So if you have to urinate, you can hopefully hold in. But there's a condition as you get older called sarcopenia, which just means wasting away the muscles. So this wastes away too. And a lot of people that have back problems, it's not their back that's the problem, it's their core. Their core is too weak. So what Audra's going to talk about, one of the problems is unfortunately as you get older, something called incontinence, where all of a sudden you're going to go to the bathroom and you just can't wait anymore because your sphincter muscles aren't strong enough. So what Audra just educated me on a few minutes ago was basically, I said, oh, we're going to do it with the Kegel. She says, oh, no. Much better than Kegel. So so here's Audra, and Audra's going to get into basically how to get all your muscles strong down there.
Hi guys, so I'm going to be talking about general pelvic health and aging. I do apologize, I had a PowerPoint and we're having technical difficulties, so there would be something to follow along with, but it's not there, so I'll try to paint a good picture in your head. I am just going to use my phone to follow along with because I do like to talk and because I'm passionate about what I do. Sometimes I go on my little pelvic health tangent, so it's just to help me stay accountable. I promise you I'm not texting people or anything right now, so but we'll get into it. But just some background information on me. I am a pelvic health occupational therapist. I've been an occupational therapist for over 5 years, specializing in pelvic health for over 3. I own my own practice, Autonomy Pelvic Health, up in Leominster, that I have had open for over a year now. So I have background working in hospital settings, skilled nursing, outpatient, geriatric site, home care. So I have a lot of practice working with the geriatric population. So, and given those settings I've worked in, I can see there's a real need for pelvic health education because it's really more than just about Kegels and weak pelvic floor muscles and things like that. So I really hope that this helps you understand that there's more to pelvic health than just Kegels, and what are some things you can do outside of that, because I'm going to tell you right now, Kegels are probably not the solution to your pelvic floor needs. So, but we'll get into that. So I like to always ask people, like, so let's say outside of Kegels, like, what do you guys know about pelvic health? Or if you hear it, like, what comes to mind? Was it because your answer was Kegels?
Yeah.
Okay, okay. Anybody have a good guess, or, you know, there's no such thing as a silly answer, you know. Don't all jump at once.
Question is?
When you hear pelvic health or pelvic floor, what comes to mind? What pops in your head?
Uterus.
Uterus, yeah. Mm-hmm. Us ladies in the uterus, yeah, we know all about that, yep.
Bladder.
Bladder, mm-hmm. Two very vital organs, especially in like the female pelvic floor. Yes, so bladder, uterine function, perfect. Anything else?
But incontinence, obviously, that's the first thing that comes to me.
Yeah.
My father-in-law, the last few years in his life, he was wearing like an adult diaper. That happens a lot. So I think the whole point is, I don't want to do an adult diaper unless I have to. So I think the whole point is, just like when I train, you know, I train clients. I'm a personal trainer. I work on their core exercises. So I think what Audra's doing basically is she's working on the lower part of the core exercises. So, and again, before you start having back pain, or before you become incontinent, I think what you want to do is you want to strengthen those pelvic muscles.
Yeah. Strengthening pelvic muscles is important, and also too, like, you know, making sure that the muscles are able to move in what we call a full range of motion. So, you know, we'll actually go into like the anatomy of it so you can better understand why we'll talk about strength, but other key factors. So this here is a model of your pelvis. Keep in mind, this is more of like what the female pelvis looks like, but the male's is very similar. So you guys can see here, this is your pubic bone that sits in the front, so it's that hard bony part. If we turn it around, you can see the back of the pelvis, and you can see how the spine connects into your pelvis. So this is what we call your lumbar spine. Think of your low back, you have your sacrum, and then your tailbone here. Can you guys see there's like this red tissue that shapes around the bottom, and then if I turn the pelvis this way, it forms this bowl-like shape. You see that red tissue? Those are your pelvic floor muscles. So your pelvic floor muscles are muscles that connect throughout the pelvis. So they connect from the front to the back of the pelvis and to the sides, and they form this bowl-like shape, right? Or you can even call it a hammock. These are made of skeletal muscle, just like the muscles you find in your bicep and your quad. So why is that important? This means these muscles have to have not just good strength, but good range of motion. So if I want to have a good contraction of my bicep muscle, I have to make sure my bicep muscle can fully lengthen to fully contract. If my bicep is stuck here, do you really think I'm going to have a good contraction? No. So I need to make sure that when I'm treating pelvic floor issues, that my patients don't just have good strength, but can the muscles move freely, right? That would be like trying to squat, but you can only move this far and this much, right? And you can't really do a good squat, right? The muscles are also really cool though, where they have to have what we call good coordination. Your pelvic floor muscles are meant to just work spontaneously without you thinking about it. So if I jump, you know, people say, oh, if I jump, I'm going to pee my pants. My pelvic floor muscles' job is to, when I do this and I land, I don't pee myself. I should be able to do that without thinking about it, which means I should be able to jump without being like, okay, let me like Kegel at the bottom of the jump, because that's kind of a lot to think about, right? Now, somewhere along the way, pelvic floor is either lost, maybe it's strength, maybe it's range of motion, coordination, or because pelvic floor connects to the whole body, which we'll talk about, maybe there's an issue somewhere else in the body, and now pelvic floor is doing all the work for everything else, right? So let's get into that. Did you know your pelvic floor has 5 main functions? So first one being, which Phil had brought up, is maintaining continence and elimination. This means you should be able to hold in pee, poop, and gas until you're ready to go. And then when you're ready to go or eliminate, it comes out without you having to strain, without pain, or whatever. So you shouldn't be sitting on the toilet being like, I have to really push out this pee, or I'm trying to poop, right? It should just come out without effort. If you're having issues with it, or pain or bleeding, that might be an indicator your pelvic floor needs attention, right? Second function is for sexual health and intimacy. So for those people who do engage in it, it should be comfortable. There should be no pain or issues with that. The third is support. So your pelvic floor muscles, remember how we talked about the bowl-like shape? Well, your organs, see if I can pull two of them out that we all share, they help support things like your bladder, this is what your bladder looks like, and help support things like your rectum. If you're female, help support things like your uterus and your ovaries, and if you're a male, your prostate. So now look here. Now you can see these muscles support your pelvic floor organs, right? But your pelvic floor also supports everything that sits above it. So think about everything in your abdomen, like your stomach, your liver, your intestines, your spine, right? So pelvic floor is kind of doing a big job, right? The fourth function is stabilization. So you ever hear people when they go to pick something up, they go, oh, I just threw out my back, right? Sometimes those issues are stemming from an issue in the pelvic floor, because your pelvic floor helps to stabilize your pelvis and spine. So when you do things like bend down to pick something up, or you squat down, you can do that without hurting something, right? The fifth function is circulation. So your pelvic floor muscles help to pump blood and help pump out excess fluids and toxins from the body, right, to keep everything flowing. You guys surprised that the pelvic floor does a lot here? So can you see how it's more than just looking at Kegels when we're looking at the pelvic floor, right? So, let me see where I'm at here. So with like pelvic health, you can see like what we're really doing is we're addressing not just the pelvic floor muscles, but really the whole body, right? I like to tell people we're looking at not just the physical well-being, but your mental and emotional, spiritual well-being, because as you can see, our pelvis connects to our spine, right? So physically, we have all these connections to our body where maybe we need to look at what's happening up in the shoulders or down in the feet, because that influences how pelvic floor works. But also, things like your mental health affect how your pelvic floor works and things like that, which we can get into further. These were some anatomy pictures I was going to show you, but we can't, so. Okay. So conditions and diagnoses we treat, right? Obviously we talked about incontinence, but you know how we talked about difficulty eliminating? So we might have people who have issues with like constipation, right? Or they're trying to pee, but everything's like dribble, 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 dribble. You're having pelvic pain. Maybe anybody heard of a prolapse before, right? So prolapse, if you guys don't know, that's when you have a organ or multiple organs in your pelvic floor that descend out into either the vaginal canal or out the rectum, right? That can increase likelihood of incontinence, constipation, pelvic pain, discomfort, things like that. But we can even treat things like back pain, hip pain, groin pain, abdominal pain, because it all connects, right? All these muscles and fascial tissue, things like they connect. We work with people prenatally, postpartum. We work with aging population. We work with pediatrics. So pelvic health is really for everybody and every gender and everything. There's a numerous amount of list. On the slide I had, you could see all of the different diagnoses we treat. It's a lot. And I could even try to send it out to you guys if you'd like at some point. I'd like to ask you guys, now there's a few that come up on this list, but there's two that I put that are really important, especially for the geriatric population. What are two of the top reasons why people 65 and older end up in the hospital? Falls. What's the second one? It relates to pelvic floor. UTIs. So this is why pelvic health and aging is so important to talk about, because with falls, do you know what's the most common reason why people fall?
They don't have the strength.
Yep. What about, let's think about pelvic floor related. Why might somebody fall related to that? Yep. What about, I have to pee so bad, I'm like so afraid I'm not gonna make it to the bathroom. So we have a lot of older people who have things like urinary leakage or urgency, where they're like, I really don't want to pee my pants. I don't want to have to go through the whole issue of like changing my pad or my pants. So what they do is they get up, they go really quickly to the bathroom, but then they fall on the way. And why they fall, we're not really sure. They could have tripped over something. Maybe it was at nighttime where it's dark and they couldn't see where they're going. Maybe they started to drip pee on the way and they slip on it. So pelvic floor issues and falls go hand in hand, right? Which is why we have to address both of them. And then UTIs, right? That's a common thing. What causes UTIs? There's multiple reasons. If you're dealing with issues of incontinence, right, that can increase likelihood of UTIs, especially if you're constantly wet in your pants or your pad, or if you're dealing with like bowel incontinence, right, and the stool ends up getting closer to the opening of the urethra, right? And UTIs, especially as you get older, they start to affect you differently. They don't just cause you necessarily the increased urinary output and pain, but it can alter things like your cognition too as you get older, which gets really scary. Has anybody ever seen or worked with somebody when they had a UTI? They're like, I don't know who this person is. Their personality changes. It's really scary, right? And so we really want to take care of those two things, which is why with the aging population, we need to work on fall prevention and UTI prevention. And a lot of that is going to be with addressing the pelvic floor and your pelvic health. So with that being said, what are some things like, why does the pelvic floor get affected as we age? Number one, just because we're getting older doesn't mean we have to be susceptible or deal with pelvic floor issues, right? I always hear people say, or some of my older clients are like, well, I'm just old, so of course I pee my pants. And I'm like, well, aging does increase likelihood of certain conditions, but that doesn't mean we have to deal with it, right? But as we get older, we go through all different types of changes. Changes in our muscle mass, our bones, our heart, our lungs, our skin, our hormones. That's a huge one, especially for females, right? Anybody here know of people during peri or postmenopause? They're like, everything feels different. A big part of that is hormone driven, especially when we have that drop in estrogen. That drop of estrogen affects the pelvic floor muscle tissue, right? Because estrogen is one of those hormones that keeps that pelvic floor tissue firmer and kind of more plump. When we have lower estrogen, that's what makes things down here feel kind of softer and more lax, which is why a lot of females may not complain of pelvic floor issues until after they go through menopause. Eventually they'll say, why am I now leaking pee? Why does everything feel heavy? Things like that. So managing your hormones, especially as you're aging, very important for your overall health, but especially your pelvic health. And again too, when you have changes in, let's just say, your activity levels and things like that, that's also going to affect your overall health and your pelvic floor health as well. Let's see here. Some other factors that influence your likelihood of having pelvic floor issues are, I'm sorry for the ladies in here, but the number of pregnancies and deliveries you've had, right? The changes our bodies go through when we're pregnant, the postural changes, the systemic changes, the load on the pelvic floor, right? Like, being a woman, it really takes a lot, right, to carry and deliver those babies, whether they're vaginal or C-sections, so that increases the likelihood. If you're not active, if you're very sedentary, that affects your pelvic floor muscles, right? Muscles need movement. You have to move your bodies. If you lack fluids or fiber in your diet, that's going to affect how you're peeing and how you're pooping. The different types of comorbidities and conditions you have, right? So things like diabetes or heart disease, right? Even if you have those conditions, it's important to manage it because it can in turn affect how your pelvic floor functions, right? Your mental health, right? This is not talked about nearly enough, but your mental health plays such a huge role in your pelvic floor. Think about people who maybe are very, very anxious, right? Have you ever been around someone who's just very generally anxious and they're kind of like this, the deer in the headlights? What does that do? It causes a lot of muscle contractions throughout the body. You get very tight, you get very still. nervous system is in this very heightened stage, which means our parasympathetic nervous system's not engaged. That means we're not able to digest well, we're not able to rest well. That can increase issues of like bowel health, urinary frequency, things like that, right? If you've ever felt super anxious and you're like, why do I feel more in pain? Or why do I feel like I'm running to the bathroom more? Could be part of that. Or someone who's depressed, right? They're not as likely to get up and move their bodies, or they're not likely going to get up and eat and care for themselves. So if we're not doing these basic day-to-day activities to care for ourselves, our pelvic floor is going to feel it too, right? So that's why we have to also address the mental health side of things when it comes to pelvic floor health. Even related to like not socializing, engaging with other people, right? I think we could see with the age of COVID how that affected people. People weren't able to get into the community, go to gyms, you know, come to the senior center, things like that, right? When we're not able to engage with other people or do activities we enjoy doing, especially if it's things like, I'm afraid to do this because I'm gonna pee my pants or I'm embarrassed or ashamed, that can lead to things like general cognitive decline and mental health decline as well. So when it comes to pelvic health, can you guys see how it's really about not just doing Kegels and not just addressing the muscles itself? A lot of other factors that play a role in it as well.
Audra, the other thing I just read about my sister's a nurse, and she told me she ran across a study, and she found out the number one factor that they found in terms of healthy aging is actually community.
Yes.
Is actually being around other people more than anything else. So that's one of the reasons why, obviously, you know, any kind of like this, it's a huge difference. I forgot the number, but you know, basically being isolated is like smoking a pack of cigarettes a day or something.
Yeah.
incredible number. So I think what Audra's saying is the same thing. If you don't want to get around because you're afraid of peeing your pants or whatever, obviously that's going to keep you. And I think people talking about doing, you know, squats and everything else. I mean, what Audra's saying is you're getting up and down. That's going to strengthen it, because I never thought about it until you brought it up. That's really the core. I mean, everything is around there. It's around here and over here. The other question for the gentleman in the room, would this help also with the large prostate?
Yep, absolutely, yeah. Like pelvic health is really for everybody, any gender and any age. You know, it's just because, like, you know, I always have people talk about the pregnancy postpartum population, because that is a huge part of the people I treat. But I was like, well, it's not just, you know, for women or people or babies, it's also for men too, right? Especially issues like prostatitis, you know, we have to make sure we're treating those as well too, because enlarged prostates can lead to issues like urinary urgency, leakage, difficulty with your bowel movements, sexual dysfunction, things like that. So yeah. But yeah, community plays a huge role. So something I work on with like my clients is making sure, instead of just assessing like all the physical aspects of their body, I'm like, do you have support systems? Like, what kind of hobbies do you do? Like, what are these pelvic floor issues getting in the way of, right? Because it's deeper than just being like, I can't go to my, you know, 65 and older fitness class because I pee my pants. It's deeper of like, I'm known as so-and-so that always has to run to the bathroom and change my pad. Like, everybody knows that because they see me go back and forth in the bathroom, right? Because imagine if you think about like your favorite activity right now, and imagine you couldn't do it because you were in pain or you were peeing yourself, like how that would make you feel. Not good. And I know some people kind of just, you know, they laugh it off and whatever, but a lot of people really are negatively impacted by it. So just because you're older doesn't mean you can't improve your health and shouldn't take action on it, right? Because pelvic floor issues really do affect your overall health and wellness. Now, why does this not get talked about a lot? Anybody have a good guess of why maybe we don't talk about these things enough?
It's embarrassing.
It's embarrassing, yeah. It's not easy to talk about. It's frustrating, you know, and with our society too, like, it's becoming more talked about. It's becoming more in demand because people see there's a need and that a lot of people are struggling, but we still have people who are like, don't talk about pee, don't talk about this, don't talk about pooping, like that's no. It's like, but everybody does it, like why don't we talk about it, right? Exactly, it's like everybody talks about it, everybody does it. But because for society in a long time, these things were considered taboo, don't talk about it. And I do know, given in your age range too, right, a lot of you guys might have grown up in households where your parents were like, we don't talk about that. Nope, if you have a problem, just suck it up, deal with it, especially if we're related to down here, right? Yep. Remember talking to this about my mom, who was telling me about with like her mom and their mom, and you can kind of see how over generations things have changed, right? This is why I come here and I talk about these things, because one, when we have awareness of it, we're able to know that there's help and we can take action. But bringing awareness is what's going to help ourselves and the community too, right? So know that taking care of your pelvic floor is going to help take care of you and other people as well. Okay. So what are some things then that you guys can do outside of Kegels? Now, first, let me kind of go back and explain why Kegels may not be the solution. So, you know how you guys talked about it's like a tightening of the pelvic floor for strengthening? So let's talk about the mechanics of the Kegel. So, you have what's called your anterior front muscles of your pelvic floor and then your posterior back muscles. So front muscles are the ones closer to your pubic bone. So think about the front of the body, then you have your posterior muscles, the back muscles that are closer to the butt. To do a Kegel, the front muscles have to squeeze, the back muscles have to lift. So let's just say my hand's the muscle. My hand has to squeeze and lift up this way to do a proper Kegel. Now, remember how I said range of motion and coordination is important? Do I want to be stuck like this all day? Probably not, right? Because that would be me equivalating to being walking around like this all day, right? Yeah. It has to let go. So we also have to teach what we call a reverse Kegel, which is letting go and relaxing. When I assess people's pelvic floor, guess how many people do it correctly, a Kegel? They hardly know it, and that's actually very true, right? A lot of people, when they do it, they're either just like squeezing, or they're doing the opposite, which is called bearing down, which is where they're taking those pelvic floor muscles and they're pushing down and out. Now, when we have a lot of that bearing down pressure, that can increase our likelihood of incontinence, irritation, and things like that. Why? You know how Phil was talking about the sphincter control, right? To hold in urine and bowels, you have these sphincters that stay closed shut until you're ready to go. But what if I have all this pressure and force being put on the sphincter? What do you think is going to happen to it? It's going to open up, right? So with pelvic floor stuff, we also talk about what we call pressure management strategies. So we work on ways of helping to reduce all of the downward pressure on the pelvic floor, which things like core strengthening are very helpful with. Breath work, other things, super helpful. The other thing is with pressure management, right? You see how the pelvic floor, we talked about, it's attached to the abdomen, the spine, and the hips? Well, what happens if the other parts of the body aren't doing their job? Maybe my hips are really tight and weak and they're not doing their job to stabilize. What do you think is going to happen to the pelvic floor? It's going to work overtime, right? If you guys have ever worked overtime or put in extra hours at work, right, you know how tiring that is. Think about what happens to the pelvic floor. Sometimes these muscles are doing way too much work because something else in the body isn't holding up its weight. So my job as Miss Pelvic Floor Detective is I have to see, is it really a problem in the pelvic floor or is it somewhere else in the body? Which that goes to show you why it's not just as easy as let's just do Kegels and resolve it, right? Because one, if we're not doing them properly, it's not going to help. Two, it can make matters worse, especially if you're pushing down or if the muscles are really tight. Do I really want to keep contracting a super tight muscle? Probably not, right? It's not going to be comfortable. And also, too, it's just, it probably only gets you to a certain point. Maybe some of you in here are sitting here thinking, I did Kegels and it maybe helped a little, but I keep doing it, it's not getting better. That probably means there's something else that has to be addressed too, right? Plus, I think Kegels are just straight up boring. Phil, you probably have a bunch of different core, fun, strengthening exercises you do with people, right? There's so many other ways to strengthen the pelvic floor than just Kegels, which, by the way, you can decide if you want to continue to do them or not after this. I recommend don't because they might not be benefiting you. If you do decide to do them, please, please, please stop doing them at stoplights and stop signs. I don't know which doctors keep saying this because it's everywhere. But I'll have clients say to me, my doctor told me to try to do 100 a day. which I'm like, that's a lot to keep track of, number one. Number two, they're like, they recommended I do it while driving and sitting at a stoplight or a stop sign. I don't know about you, but us Massachusetts drivers are not necessarily the best. So I'm sitting there at the wheel, instead of being like, Kegel, 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 I'm like, let me double check before I cross this green light to make sure someone's not gonna ram through and hit me. So if anything, just don't do them when you're at stop lines and stop signs. Focus on the road, right? There's already plenty of things you have to do. So it's always just my little nibbit with that. So when or sometimes you should seek out a pelvic floor therapist. So just to reiterate, if you're having any issues with your urinary function, so you're peeing your pants, whether it's you sneeze, you cough, exercising, or you're like on the way to the bathroom and it starts coming out, maybe you're somebody that feels like you're peeing like every half hour, hour, or if you're getting up multiple times a night to pee, because even though you're older, did you know you shouldn't get up more than once a night to go pee? If you're doing that, that's when a pelvic floor therapist is going to benefit you, right? Or you're someone that's like, I have to pee, but it's not coming out, it's not a steady stream, that's an indicator. Same thing with your bowel movements, right? You should be able to sit, relax on the toilet, it comes out without effort or having you sit there for 10 minutes straining. If you are straining, please do yourself a favor, get off the pot and try again later, because you do not want to deal with hemorrhoids and things like that. They're not fun, right? If you're having any type of pelvic pain, or maybe you're someone that feels like, you know, there's just all this tension and heaviness in here that I don't know where it's coming from, right? That's an issue. If you're having any like sexual related issues you want to address. If maybe you're somebody that's had issues with like chronic low back pain or hip pain, it might be a pelvic floor issue. It might not be just a hip issue or a back issue, right? So if you're someone that's like, I've been to multiple like PTs and OTs for my low back pain and nothing's gotten better, might want to go to a pelvic floor therapist, because the driver might be from here, right? If you're somebody that's maybe had a hysterectomy, or maybe you had your prostate removed, right, and things just haven't felt right down there, you can go to a pelvic floor therapist to seek treatment for that. So there's millions of different examples of why you can go and see someone. And the good news is you can go see a pelvic floor therapist, whether it's in person or online. There's a bunch of them around here. You don't have to necessarily, in Massachusetts, go right to the doctor to see one. Massachusetts is a direct access state, so that means you can go right to the provider first. Pending your insurance, they may want a script from the doctor, right? But honestly, it's much easier to see a pelvic floor therapist than I think people think, so. And I think that was it for me of all the information I had, so. Thank you. I would love to take questions, because I know there's probably some questions here.
Are there any specific exercises?
It depends. So we are all different individuals. It's hard for me to say, do this exercise, because what works for you might not work for someone else, right? I'm not sure, Phil, you can attest to this with the individual people you train. So depending on who you are and your goals, what your exercises you need are going to look different than from someone else. But what I will say is things that you should do to help your pelvic floor is move your body. So things you can do to help your pelvic floor are find ways of movement that are enjoyable to you and purposeful. Walking, yoga, strength training. I really highly recommend every person does some form of strength training at least 2 times a week, even if you're older. Pelvic floor muscles, they do need that load. They need to be trained how to move along with the rest of the body. Also, on that topic, other things you can do for your pelvic floor to help it, stay hydrated. You should try to aim for at least half your body weight in fluid ounces a day, unless you're on a fluid restriction diet, because some people with like cardiac issues can only drink so much a day, so follow that. Eat your fiber. You need to have different types of fiber, prebiotics, probiotics, things like that. For women, you need about 25 grams of fiber a day. For men, you need about 38 grams of fiber. Because do you want to know a big driver of pelvic floor issues? Constipation. That is like probably the one thing I see across people 65 and older is constipation. It's a huge driver. Constipation is not also just about not like being able to poop every day. It also looks at the quality of your stool and how you're pooping, right? So if you're going every day, but you're having like those hard little pellets, guess what? You're still constipated. You need to be having soft bowel movements every day that aren't effortful to pass, right? Remember, no bleeding, no pain, no issues, right? So even if you go every day, it doesn't mean that you're not constipated, right? What else was I gonna say? Yeah, movement, hydration, this and that. Making sure you're staying active, we talked about that. Making sure you're seeking help if you're having mental health concerns, if you're having concerns with your balance, right? We talked about falls, fall prevention. If you're feeling like you're not very steady or you have weakness in your legs, go see a physical or an occupational therapist to help you with that, right? If there's another underlying issue that affects your pelvic floor outside of pelvic floor therapy, seek help for that, right?
Well, the other thing is, what Audra brought up is the big thing, it's called sarcopenia, wasting away the muscles.
Yeah.
And they found out, the other thing I would do in addition to that is actually people over the age of 60 need more protein than a bodybuilder does. Because we're not able to turn our protein over, so the number one cause of falls, they used to believe people get dizzy. It isn't, because they're so weak that their muscles can't hold them up, so they hit a little piece of paper and they fall over. Going along with the muscle is also sarcopenia, but also osteopenia and osteoporosis. And what Audra's saying in terms of resistance training is what's happening. You're not only building your muscles, you're also building up your bones. We covered that before. The osteopenia, osteoporosis. So what you want to do is you want to get good quality protein. I personally like, grass-fed, grass-finished, happy cows, happy chickens. You want that. So you want good quality protein, because you want to build up the muscles. You need actually more protein than a bodybuilder does, because the bodybuilder can turn over that protein. We can't do that. We can't do that as we get older. So all the stuff you guys are doing the squats and everything else, you're not only helping in terms of your pelvic floor, you're also helping in terms of your overall health. Other thing Audra was talking about, my 4 pillars of health. One of my pillars of health is sleep. Sleep is so important. They found out if people, as they get old, if you don't get the good quality sleep, you're a lot more likely to come down with all kinds of mental, in terms of dementia and things like that. So it not only affects your getting up, it's also affecting your cognitive health. So that's why everything, we're an ecosystem, right? Everything is connected, and because remember what Fred talked about before. Or you can have great quadriceps, but maybe your glutes are too weak, and that's the whole thing. So it's hard to see. We've had a lot of physical therapists, and orthopedic surgeons on my show, and they think, gee, maybe you think your knee's bad, but maybe it could be your feet are off.
Yeah.
So it depends on, we have a chain, we have a kinetic chain. So Audra's saying maybe your pelvic muscles are causing the problems in your back. Because you're having an issue in one place doesn't mean that's where the problem is. The problem could be related to something else. So we're basically, again, we're an ecosystem. Everything has to be connected.
Yeah, which is why if you've been to pelvic floor therapy before, or maybe you know somebody who's been and they said all I did was just Kegels, it doesn't hurt to try again, right? Because we also know way more than we used to. One of the reasons why Kegels were so common was just because for the longest time that's all we knew. That's all we knew, is just that pelvic floor moves in this certain way, but now we know so much more, right? Plus, the other thing to think about is women weren't included in research studies until I think it was, you might know this, 1993. So it's been just over 30 years, and now women have been introduced in research studies, which women make up the majority of people who go to pelvic floor therapy. That kind of blow your mind. So now we know more, and as we know more, right, especially with, Phil, we're so into the research, as things change, we learn more and we change how we do things based off of what we know. So at the time, maybe years ago, your doctors told you Kegels because that's just what we knew. That's all we knew. It doesn't make them a bad person or anything like that, but now we know more. Plus, one clinician just might have a different viewpoint than another one, right? So, and maybe you just need to find somebody that has an approach that's going to fit you and your needs. Plus, pelvic floor issues take time. Any health issues take time, which I have people who will say things like, so Audrey, I did those exercises for a week and I'm not 100% better. Well, it's only been a week, right? Takes change, right? Especially if we look at things like pain, it takes about 12 weeks for your body to respond to pain when you're on a consistent program. You have to give this stuff time and consistency. Plus, as you can see, pelvic floor issues really are about also making lifestyle changes. That's not easy to do, right? That takes time. That's why it's important you find someone that'll help you stay accountable. You make small goals and you stick with it. And I say that because I know how frustrating pelvic floor issues can be. I already know it can be really hard to just sit in a pelvic floor therapist's office and have to say to their face, I pee my pants or I poop my pants. Like, that is a really hard thing to say. Like, we know that. So the fact that you have taken that step to go in, there's a big step. Now it's just about working slowly and efficiently so that you're making these gradual lifestyle changes to live and age gracefully. So if they've only been doing stuff for 1 week, I hate to tell you, you gotta keep going to see changes. So
So Audra, would basically just doing basically core exercises, would that automatically engage the pelvic muscles also?
depends. So it depends on how people move and engage their core, because you could have really good core engagement, which, by the way, when we talk about core, your core system is not just your abdominal muscles. It's your abdominal muscles, but it's also the muscles of your back, your pelvic floor, and your diaphragm, which is that respiratory muscle that moves. You can engage that, correctly, but if you're still having issues with like pelvic floor movement and range of motion, there might be more work we have to do. So core strengthening is a good thing to do, but you could have the strongest core but still have some issues, if that makes sense, because there could be other things. So when it comes to pelvic floor issues, right, there's no right exercise, but core strengthening is a good thing to do. You also need to make sure you're strengthening your legs, like your glutes, your back. You need to make sure you're doing mobility work, right? You don't want to be, all kind of stiff like we talk about the bodybuilders, right? I see a lot of the bodybuilders at my gym. I don't think I ever see them warm up or stretch at all. They just go right to the weights, which it's good, but they also, a lot of them walk around like this, which that's just not very comfortable, right? So we have to make sure we're also keeping that range of motion of our muscles and our joints in check too, right? So mobility work is also important, right? Mobilizing your feet, your ankles, your hips, your back, even your chest into your shoulders, your neck. It all connects in some way, shape, or form. It's really a whole body strengthening mobilization approach.
Right, like we had Fred on. I know you guys love Fred. That was the whole thing Fred talked about too, is in addition to the strength, but he was doing also the stretching. The stretching's so important, and it helps with the balance, it helps with everything. So again, we're an ecosystem. The hip bone's connected to the knee bone. So that's the whole thing. You could have, if one part of your body, I know I love physical therapists, occupational therapists too, is this whole thing is, I had some issues before, and they went in there. In fact, I saw an orthopedic surgeon, and they thought I had an issue with, with my neck, but it was really, they said, oh no, it's over here.
Yeah.
Because even if you get a pain here, it's really related to something else. That's why a lot of times you have to see an occupational or a physical therapist, because they could be able to figure out which particular muscles are not firing correctly and which muscles you need to work. With me, I had problems with my glutes, and the physical therapist, oh, your glutes, this glute is too, because I had hip replacement, so this is too weak. So now we got to do these particular exercises, and then they put you on the table and they watch, oh yeah, you're doing better, and you're going to walk like this and the rest of it. So again, you need an expert basically that can figure out exactly where it is. So again, you may think you're having back problems, but the back problems emanate from the pelvic muscles. And this is something I was totally ignorant of, to be honest with you. And I consider myself pretty well informed, but I had no idea this even existed until I met her. So I mean, this is stuff. What I love about this, we all learn something new all the time, right? Fred came in and did all this other stuff. We have other people coming on, and we had Kelly come on talking about different stuff. So the whole point of this is basically my mantra is give you at least one suggestion to make your life a little better. So hopefully we gave you more than one today.
Yes. So, and good to go off of that too. I know Google is a super accessible thing, but please, 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 if you're having pelvic floor issues, go to a pelvic floor therapist. Dr. Google does not know everything and it's not accurate. Okay, the people are like, I've been following these exercise programs I typed in on Google and nothing's working. Like, well, it's because that's not what's for you. They're there to increase accessibility, but just because it's there doesn't mean it's what's going to work. So you can also use Dr. Google to say, find pelvic floor therapist near me. Click, okay, look at all these people that pop up. So, do we have any other questions? You know, sometimes when one of us has a question we're nervous to ask, I bet you somebody else is thinking the same thing. They're also nervous to ask, so.
Again, I think this is a field that I really knew nothing about, so I'm guessing most of the people here knew nothing about it either. So there's kind of an education in terms of, at least we're aware of it now, that maybe this is a problem that, you know, that could be related to something else.
So we know you can't show exercise for everybody in the room.
Mhm.
And the exercise never works for everybody in the room because all our bodies are made up differently.
Yep.
All right. But could you show us some ideas of how to do some of the exercise, even though it's not going to pertain to Phil because his body's not set up for that one, or myself, because my body's not, but a general idea so they can have something to take back with them and know, okay, so this is what she's talking about.
Mm-hmm.
It's okay to stand up there and read the whole thing and not, because you know it like the back of your hand, but it's new to a lot of people, but with that, you need to show something that they can understand. Like you do, when you do your talk, you show, okay, so in front, do the squats, you know what I'm saying? It's the eyes see everything. Like they say, a picture's worth 100 words or whatever, 1,000 words. The same difference.
Yeah. So let me kind of reframe that, because again, everyone has different needs. But let me give you what are some maybe things you should focus on in terms of movement? How does that sound? So
Perfect.
beneficial movements for people are some type of cardio movement. That's important for your overall pelvic floor health, cardiovascular health, right? So like walking, or if some people do here running, or you do some type of cardio class. Squat variations, right? So something where you have to sit up and down is important. Hinging exercises, something where you have to shift your hips back and use your hamstrings to come up. Anything that involves rotation of your trunk's important, right? Because we all don't just go and pick something up and then do this, right? We have to be able to rotate to move. So rotational movements, things that cross the body where it's left to right, or from upper right hand corner or left corner to this one. Unilateral movements, which means working on one exercise at a time. So like stepping up onto a step, right? Or practicing like a single leg kickstand or something like that. Even single arm exercises, right? Taking a dumbbell, lifting it up overhead, punching across. Core exercises where you're practicing stabilizing the trunk, but also ones that require movement, like a sit-up. So plank is more stationary. You know, other ones that are kind of more movement, right? You can think about like a crunch, things like that. So it's kind of hard because I know what you're saying, you want to see it, but again, my philosophy is like, I could spend all day up here too. I could literally spend all day and into tomorrow showing you exercises, but you do have to do exercises that people will call kind of functional, like what relates to your movement patterns. Also for you guys specifically, anything where you have to practice getting up from the ground, because guess what? If you do happen to fall, but you can't get up, you might be laying there for a really long time, right? And then it's not fun if you're like on the way to the bathroom and you can't hold it, and you're sitting there on the floor, someone finds you and you've been incontinent, right? So for you guys, practicing exercises that challenge you to get up from the floor, so that if you do happen to get up or fall, you can get up on your own, or at least crawl to call the phone and things like that. Is that helpful? Yeah, okay. Like I said, it's really hard because I'm like, I want to show you guys so many things, but at the same time, I don't want to overwhelm people either, because there's a million things we could do, right?
Well, the other thing we talked before, just doing this, right? Just doing this. We talked about that. It's just keep getting up. Remember, we did before. Everybody before, we're just doing this, right?
Yeah.
No. Okay, do it at the beginning, but again, each commercial come on TV. Just get up. There's a book, Atomic Habits by James Clear. He talks about that. Get into a habit. I met you guys, my father-in-law, Eddie Saloom, Eddie's on Park Ave. I had a big thing under the TV. I said, get up every commercial. I just want you to get up and walk around. Again, we talked about this before, even with Fred. Can you do this? We did it with one leg, remember?
Yeah.
One leg.
Yeah.
So, just simple. They call it activities of daily living. Okay. In fact, I mentioned this before. Do you know the number one? You guys should know this. I mentioned this before. The number one most difficult thing for people to do every day for everyday things is getting out of a chair. Because you've got to work your quadriceps and your glutes. And what happens now? We talked before. Toilets now they have the things on the side, right? Because people they can't get down. So what happens? The old adage: either use it or either use it or lose it. It's the same thing with the muscles. So you don't have to go to the gym. All you got to do basically is just get in and out of the chair a few times. So there was maybe there's a specific test they give people. How many times you can get in and out of the chair within a minute?
Yep.
And that kind of can measure. Can do an assessment of you. What kind of shape are you? Can you get in it? Can you get in and out of that chair with so many times? So let's say you can get in and out of the chair 10 times in a minute. Then try to do it 12 times in a minute. And then what happened, your muscles will adapt to whatever you need to do. There was a famous story in terms of, was either, Spartacus, that movie Spartacus. They say the reason he got so strong was he used to be on a slave ship and he was rowing. And I'll tell you, if you're in a slave ship every day, you're going to get strong.
Yeah.
Because what happens is your body will adapt to whatever happens with that. Your body will adapt because our number one rule as a smart monkey is not to die. So if we keep stressing those muscles, your muscles will get bigger. Your quadriceps and your glutes will get. So if you take one thing away from this, is basically just get up, up and down over and over again, and that's going to do it. It's a core exercise. You're using everything.
Sounds good.
Okay, thanks guys. Thanks Audra.
Thank you.
Thank you.
If you guys are interested,
One of the most common questions I'm asked as a biochemist and health coach is what are the best supplements to take? Choosing supplements is a tricky business. Many companies have poor quality control and questionable ingredients. In the past, I had to send clients to several different websites. I am now able to offer one-stop shopping for all the quality brands I recommend with no shipping cost and a lower price in most cases. Just email me, philgeorge@charter.net for a free consult.